Hello, and welcome to the latest video from Adolescent Medicine Consulting. In this video, we continue our series on what to do when. For those of you who have been following along, thank you for tuning in again. This series is focused on what to do when you get a positive or concerning answer on the psychosocial screen or HEADSS assessment. In this video, I want to take a pause before delving into some of the more sensitive questions on the psychosocial assessment, the drugs, sexuality, and safety questions, to talk about how adolescent development impacts the way we complete the visit. For those of you who are new to Adolescent Medicine Consulting, welcome. I am Dr. Mira Bihari, a pediatrician and adolescent medicine specialist with over 20 years of experience taking care of teens, tweens, and young adults in a variety of settings. After watching this video, I invite you to check out some of the earlier videos for more information on how you can help the teens in your practice. As a reminder, these videos are for informational and educational purposes only. They are not a substitute for your own clinical judgment and are not a medical consultation. If you have a more specific concern, please reach out to us directly through our website, adolescentmedicineconsulting.com, or through this platform. Adolescence is all about transitions, moving from being a child to being an adult. This process takes time and has been divided into phases, early, middle, and late. Dr. Sarah Scherer and Dr. Mary Radzik, who I have the pleasure of learning from during my adolescent medicine fellowship at Children's Hospital Los Angeles, describe these phases in more detail in their chapter of the classic textbook, Neinstein's Adolescent and Young Adult Healthcare. A link to the textbook is in the information box associated with this video. Briefly, early adolescence is the phase from age 10 to 13, now called the tweens. This phase is characterized by concrete thinking and a focus on fitting in with a peer group as the body goes through the ups and downs of pubertal changes. Middle adolescence is generally considered to be the phase from age 14 to 16 when teens have the ability for more abstract thinking. There's a focus on friends over family, and peer pressure is very powerful. Late adolescence, from around age 17 to the early 20s, is marked by a move to more independence in actions and thoughts. The young person may physically move out on their own into a dorm or a roommate situation. The young person is focused on their future. These descriptions are for the typical phases of adolescent psychological development. All of us who are in practice know that there are some young people who develop the ability to think abstractly and think about their future at younger ages. Likewise, there are many middle and late adolescents who are still thinking concretely and continue to think that way well into adulthood. Part of these variations are due to environmental exposures and brain development. For human brains, the greatest periods of growth are infancy and adolescence. Research over the past few decades has shown that human brains continue growing and developing until about age 25. During adolescence, the brain undergoes a process of pruning where there is a cutting back on neurons that are not being used and a solidification through a process called myelination of those that are being used. Patterns are formed. We generally say neurons that fire together wire together. We also know that during adolescence, the human brain moves from being driven by the amygdala, also known as the reptilian or primitive brain, to being driven by the prefrontal cortex, which helps the young person make decisions rationally rather than emotionally. The prefrontal cortex is often referred to as the CEO of the brain. It's the last part of the brain to myelinate and is likely why adolescents make some irrational choices even when they know better. For teens who have experienced trauma, chronic illness, or other challenges, their development may be stalled or advanced. Why is this important? Well, the stage that an adolescent is in guides their interactions with you and vice versa. We likely would not speak to the child in this picture the same way we would to the adult appearing person. However, if the adult appearing person were developmentally delayed or had been very sheltered in their upbringing, we may speak to them in the same way. Knowing the different stages of adolescence and brain development is important for anticipatory guidance. We can help prepare the parents of tweens for how to deal with their changing peer relationships and how to deal with their concrete thinking. We can help teens and young adults further develop their patterns of behavior into desired behaviors by allowing them to safely practice abstract thinking. I remember loving those choose your own adventure books that had different endings depending on the choice you made earlier in the book. Using that same line of thinking, you can help the teens in your life and in your practice think about what would happen if when certain situations happen. For example, if you're driving along and have a near miss with hitting a dog that just ran across the street unexpectedly, you can ask the teen, "What do you think would have happened if I'd been looking away to check a text message?" We can also start thinking about transition planning. The American Academy of Pediatrics recommends that we begin the discussion of transitioning to adulthood around the age of 12. By letting our young patients and their parents know that this is coming up, we can address some of the concerns of parents about the very important adolescent years. We can help connect them to resources that will allow the young person to avoid dangerous situations or know how to respond to dangerous situations when they arise. For example, we can help them get connected to learning first aid and CPR and knowing what to say if they are offered drugs or alcohol. As we move ahead in discussing the remaining elements of the psychosocial assessment, drugs, sexuality, and safety, I would like you to keep these developmental stages in mind. As you see patients in your practice, think about where they are in the different stages of adolescent development, early, middle, or late. Use your assessment of the stage to guide discussions with parents about what's coming up in their child's development. Since the stages greatly affect the level of information shared during a visit, we will keep these videos focused on general information for patients and their families. For more detailed information on how to deal with more complex adolescent health issues, please contact us at www.adolescentmedicineconsulting.com or by reaching out on this platform. As always, thank you for tuning in to this video from Adolescent Medicine Consulting, where we help you help teens.